Lower back pain as a lifter is one of the most frustrating things to deal with because you want to lift, you want to get stuck into your training program, but you're often held back by pain or the hesitation of fear of pain. And the reality is there's lots of things that we can do about it. And I think someone that has been training or someone that's new into the gym, you might look at mobility and stretching and go, okay, like it gives me a window, but what can I do with that? Like, how do I make that better? And this is what today's video is about. I want to show you how to take things a step further so that you can actually look at your lower back pain and go, well, this is a way that I can progress my movement over time so that I can align that with my training as well. With training, we are creating a stimulus where our body is doing the same movements over and over again. So it's natural that we're going to get tight in certain places. But I always relate this to like a car, for instance. You drive it long enough, you're going to need to change the tires. You're going to need to change the oil. The body's no different. Over time, we're going to have to offset some of that tension that we create during training. Now, that might sound a little bit boring, like I don't want to stretch, I don't want to mobilize, but there is ways that you can progress it in a way that aligns with your training. So we can start to move into loaded, styled mobility exercises, which are challenging in a sense of a training stimulus, but also still working on mobility and range of movement. So today's video is a very practical way to help with lower back pain. Now, to kick it off, we need to have a look at how do we get your body in the best position to actually do stretching and do mobility. It's a very logical place to start. Now, when we have these flare-ups and we have these back pain in episodes, what happens is our body just goes into shock. It goes into like a protective mode, and it kind of just locks down all the muscles around the area that's potentially sore, and it really limits your range of movement. It limits your ability to get into positions, which really becomes quite problematic when it comes to training because you end up moving around the back pain, which by default then loads up other areas. Now, the tension that we get is there as a protective mechanism. It's your body going, hey, we don't want to go any further into ranges. We don't want to do any movement that's potentially going to hurt us any further. So what we need to start to look at is how do we get your nervous system to calm down a little bit? Now, one of the things is when you're tight and when you're stiff, you're in what we call a sympathetic state. So everything's just on overdrive. It's stressed, it's working a lot. It's called hypertonicity. So we need to down-regulate that a little bit and get your parasympathetic system involved a little bit more. And how we're going to actually do that is some breathing drills. Now, there are a couple of big companies, DNS, PRI, that basically have sort of brought to light the power of the diaphragm and breathing work, because what it does is it upregulates your parasympathetic nervous system and downregulates tissue tension. So we're going to start off by running through some drills that you can add in before you do mobility, because the thing is with mobility, if you're really, really tight and in these sympathetic states, you're not going to necessarily accept that mobility and be able to use it, or you might get a very short-term window. But what we want to do is get your body ready to accept the movement and the mobility, and then we add layers on top of that. Now I'm going to run you through two breathing drills. The first one is quadruped, so essentially on all fours, and the next one will be on my back. Now, just to give a little bit of context on this, when we get stuck in these positions, we get stuck in these extension positions where our rib cage flares up, our pelvis goes the opposite way, and you can see there just by default it puts a lot of pressure through the lower back. So we've got to get your diaphragm working, get your rib cage down, and be able to create a little bit of expansion. That's actually something that's going to let this tension drop off. So the first drill is something. Now I'm going to run over the particulars in a sec, but it's essentially a quadruped drill. Now you can see by that position that I just did, it really flexes you out. So it gets your abs working well, it gets the rounding of the mid and the upper back, and you can also tuck the pelvis in. So it starts to lengthen all the tissue on the back and upregulate the tissue on the front. Now I'm going to run you through how that works, and essentially you want to do 3 to 5 breaths with really long inhales. So from here, push the floor away, tuck the hips under. Now, every time I exhale, I'm tucking the hips under and I'm pushing the back up towards the roof, really trying to round out my spine. And every time I exhale, I'm thinking of pushing my rib cage down and then pushing the ground away. It's really creating that sort of C shape through my spine. Now, this is a great drill because it's pretty simple to do. You can get onto the ground, and even if you've got lower back pain, it's a pretty comfortable position to get in. Now, the next drill that we're going to run over is something that you've probably seen a lot. It's a 90-90 breathing drill. Now, essentially, I'm going to chuck my feet up on the bench here in a second. I'm going to use a roller for support, but it's the same as that drill in concept, but it's now laying on the back. Now, the 90-90 drill is great. So the 90 angle here and the 90 angle here. And what we're trying to do is essentially tuck the lower back under, and we're getting that posterior tilt, the rotation of the pelvis. You can see that flattens me out. And then I'm going to use my arms to reach, and it's going to push the rib cage down. And that's creating that center point of stability. That's creating that position of safety for your body. Now, your adductors, these feed into your deep core line, okay? Now, this is the center point of your stability. So when you have lower back pain and you're in these positions and these states of stress, we need to down-regulate all the big muscles and bring the little ones in. So by squeezing this, by reaching up to the roof, and then actively lifting the pelvis up and tucking under, this here, and you can see there I'm shaking. 5 to 8 seconds in, 5 to seconds out. 5 to 8 seconds out. And you can see that that creates that pressure on the ab wall. And you can see that that's a really stacked position. That's a position that you would be in if you're squatting or deadlifting. Now, these breathing drills, think of this as prep work to get you into deeper stretch positions. They're often a part of the mobility process that's missed. And if you add these in, it just gets your body ready to accept ranges of movement. It gets us out of those fight and flight state that we're in and allows us to then take on the mobility. So there are a ton of different exercises that you can do, but these are two really practical and simple ways to implement breathing drills to get your parasympathetic nervous system working, and then down-regulating that sympathetic nervous system. We're going to move into some mobility stuff now. Now, the first point of call for a lot of people when they get back pain is stretching out the hamstrings, but I often start at the front. Obviously, a good assessment is needed to really identify the structures that need mobilizing, but the front is often the catalyst for a lot of back pain. And the reason being is we don't get exposed to hip extension very often, which is essentially straightening out the leg. We're constantly in these shortened positions at the front of the hip, which means then you get to a certain point of hip extension and you just bend through your back. That over time builds up to be quite a problem. Now, this here, great bang for the buck exercise here. So couch stretch, and what you want to do is think about what we did with the breathing drill. So actually get the ribs down, tuck the pelvis under, and then from that position, come through. And you can see I come through with a straight line there. And even just coming a little bit further forward, I start to get a massive stretch through the front there. Now, once that sort of settles in a little bit, start to use your breath a bit as well. So big inhales, big exhales, and you can see I'm pushing my ribs down, tucking the hips under, and then continuing to lead from the hip. Now, we want to incorporate those breathing style drills into the actual mobility work as well, so that body actually starts to accept it. Like hanging at end ranges here doesn't really do a lot for us, but being in a position that's really nice and stacked, and then from there, working into these end ranges is something that's going to allow our body to understand that it's safe in this position and start to get some real length. Now, with this one, this is obviously hitting the rec fem, like your big quad, but we can drive in still with a stacked position, still glute on, and get a little bit more of that high hip flexor as well, which is super beneficial because you've obviously got the quad muscles, but you've got these really high hip flexor muscles that need some attention too. The next big muscle group area that we need to target is the adductors. Again, similar to the hip flexors, they're constantly shortened and just tight. They often don't get a lot of exposure to range of movement. So the first thing we need to do is make sure that our body feels safe and stable to actually get some length through it. Now, I would start out with what I call an adductor rock. Now, from this position here, you want to almost think you're doing a deadlift, squaring up the pelvis, getting the rib cage down, and then from there, sitting back into the hips. Now, when you rock back here, you'll feel different areas within the thigh, inner thigh getting really nice and tight. Now, the goal here is to essentially get down all the way down to your elbows and then playing around with different positions and also rocking into these end ranges just to get a good amount of stretch in there. Now, you can also come forward as well, just to stretch out that higher kind of hip flexor and adductor region. But really, the goal for this one is to sit back into it with that really nice stacked position. Then from there, you also want to hit the adductors that don't cross the knee. So just these higher adductors. Now, a kneeling adductor rock is a fantastic drill for that. And lock the back hip in, keep yourself really nice and stacked down, and start to get some exposure to these end drain positions. Now, you can also play around with different positions, but I think the key here is just to make sure that you've got that hip locked in, rib cage down, and then think about the leg being taken away from the midline. Like, that's the goal. We want to try and get that leg away from the midline. Now, if you're super tight or you have a lot of pain currently, you don't need to use the actual kettlebell for weight. You can just do it body weight, but progress it up as you go along. The adductors, same as the hip flexors, is one of those areas that lock on when you have lower back pain and they don't want to let go. So you need to essentially make it feel safe as you progress through. Now, the next drill that I'm going to run you through is an incline bench pigeon stretch. This is a really comfortable position to get into because you can actually just use your body weight to essentially get the stretch. Now, this is all about positioning, and the incline bench provides that little bit of passive support. Often people, when they do a normal pigeon stretch, will get a lot of pain on the outside of the knee here. So this here, creating that passive support, is a really comfortable position to get into. Now, with all these drills, you want to push the opposing side towards the side that you're stretching. And you can see that squares me up there. Now from here, you want to almost think of pushing that leg backwards into the hip. And then from here, we're bringing ourselves down over the top of our torso. Now, when you get down, the further you get down, you're going to get this massive stretch on the back of the hip. And then you can play around with different positions and really kind of oscillate and get stuck into those end ranges. This is great because you can just use your body weight and actually create a very similar hinge position that you would with an RDL or a deadlift. But then you can have a look at both sides and see where they're at. Now, what you'll notice is I haven't actually touched the hamstrings yet. Often the hamstrings become protective mechanism for back pain. Their job is to slow you from falling forward and to slow your torso movement down. So we don't want to just start there, because in a lot of cases and a lot of people that I treat and see, the hamstrings are just reactively working. They're not actually tight. So this is a very good and safe start spot. Often, if you then stretch hamstrings that aren't actually tight and they are protecting, it can actually make your pain worse long term. So don't start there. Now that we've got a bit of passive movement, we need to start to load things. Now, this is a great drill because, one, it's elevated, so it takes you through an extended range of movement. But two, it drags that back leg into hip extension. And you can see there, that's essentially what we're doing with the banded mobility drill, but we're actually starting to add load and add reps. Now, for someone that's really provocative, you could just sit down the bottom here in an isometric, or you can control the eccentric like I'm doing, and get yourself into the bottom position here. Now, something to note is you want to keep that hip locked in. You want to keep some weight over the front foot, so you've got most of the weight in this front leg, and you can just really get that leg to drag into extension at the back. Now, that's something that's going to start to really use the mobility that you're creating. And you can see how it's progressively gone from getting yourself into a better position, then starting to open up range of movement. Now we're starting to load it. So let's move into some other drills. Now, the next thing we want to do is start to take the adductors into a lengthened position. Now, the first exercise that probably comes to mind is a Cossack squat. Often, you just miss the adductors completely. You've got so much going on at the hip and whatnot, so I like to reduce the lever and focus just on the adductors. Now, using an incline bench can be a really good start point because we can start in this upright position, and then we can start to get some length through that adductor. You can see I'm getting that nice big stretch eccentrically from my body weight, and then squeezing back up. Now, these are not easy. Anything adductor related is very hard, so you may not have the required strength yet, and you could just start off with some Copenhagen planks. But what we want to do is start to work towards doing things in a way that creates eccentric length. It starts to really stress it out under load, because that's the thing that's going to build resilience long term. Now, the next thing we want to do is make sure that we have access to hip internal rotation. Now, this drill isn't a single leg deadlift. It's just getting the movement so that we can actually load it and get some length through the actual outside of the hip as we do the movement. So What I would do is wherever your hand is, have your foot in line with it. And then as you come down into this movement, you can see how it creates that internal bias onto that hip. Now, you don't have to lift your leg up because it's not necessarily about counterweight. It's about getting that hip loaded. So I'm shifting weight into the hip. I'm letting it come down, but I'm also thinking about pushing this hip down as well. So by pushing that hip and squaring it up, I get a bigger load through the outside of that hip. Now that lengthening under load is something that from the incline bench pigeon stretch, we're now starting to load that and take that through range. Super important to not just think about getting passive tension, but actually starting to think about how do we start to load these structures during movement as well. Now to wrap this up, back pain is often caused by a lack of movement and mobility. So when you have these flare-ups and you have these tweaks, instead of just focusing on the symptoms at the back, start to think about how we can then get the hips moving better. How do we facilitate more range of movement? And how do we get your body out of this fight or flight mode, which is the sympathetic state that it's in, and down-regulating the nervous system? So if we recap on the vid, we essentially get your body into this parasympathetic state with the breathing drills and bring it back to its neutral point. We then start to get some range of movement so your body can get used to the positions and get some length and reduce some of that stiffness in the tissue. And then we start to load it. Now, if you have nerve pain, you have nerve pain shooting down your leg, or you have any big issue like that, you still need to go and see a practitioner and get some work done. This is for the lifter that wants to add something into their training program that helps short term with a back pain or with a tweak that's not any further progressed than that. So use this video as a guide to get some range of movement going. Tread cautiously and just ease into it, because the thing is, the better you can get it moving through the hips, the better understanding you have of how to actually lengthen these tissues under load. That is one of the best things that you can do to prevent reoccurrence of back pain long term. Because the reality is, if you think about it, we sit down a lot. We're constantly in these shortened states. Everything that we do is ahead of us. So what we need to do is make sure that we get exposure to these tissues under load. It's a really logical way to do it. But sometimes we need to add some steps in, which is getting the nervous system on board to actually accept the mobility that we're doing.